This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
You ready, Imran?
Yep. Can you hear me?
Yes.
All right. So my name is Imran Qureshi. I just want to introduce myself. I'm one of the chief residents. I'm a PGY4 here at Baylor Bumsey Dallas. And joining me is our wonderful coordinator, Taylor Ann. And she's gonna, monitor if I say anything wrong because she is the all-knowing about our residency. All right. Full screen and then we can start. Are we ready to start?
All good from this end. Is it not sharing?
Just put play from current slide.
Oh, I am. Okay,
No.
Give me 1 second. Sorry, everyone.
No problem.
Sometimes you have to start the slideshow and then start the screen share.
Oh, okay.
I see your mouse moving, but it's still like in PowerPoint mode.
Sorry, everyone.
All right, it's in presenter mode. And
Turn it now.
there you go.
Cool.
Perfect. Awesome.
Sorry, everyone.
Good. All right, so we did the introduction, so we'll go first slide. I think this slide enough is to say why I really like our residency. I think Dr. Hamilton is our program director. I think she's one of the best. Honestly, not saying this because I'm here, but she's really the most personable, advocate and like easy to talk to, nice program director. And then Taylor Ann has been here for 2 years, I think, and she has really just turned us from done everything we need. Any email you have, any question you have, she can answer, and she's on top of it and bringing all of our resident needs. And then here's our social media right there, our Instagram account, bumc_PMR. Give us a follow. We pretty active. We have a lot of pictures, more than this slide will show, and then we have our website there. Next slide. So here are our residents. At Bumsey, we don't have an intern year, but we have an associated hospital, Baylor in Fort Worth. If you would like to go there for your prelim year. So we have 3 years, 3 residents per class. Here I'm in the middle on the PGY4. And then that is our incoming class right there. I think, yeah, next slide. So here's just some, ERAS stuff, what we need. Taylor, can you X out that meeting reminder? I think it's blocking some of the, or is that me or, yeah, perfect. So this is our interviews we're sending out. We go around the same time as everybody else, and we're gonna be doing them virtual. The ERAS is about, the same stuff, medical school transcript, 3 letters, all that good stuff. So I don't think this is not much new information for you guys here. So next slide. So program highlights. So we are, for anyone who knows Dallas, there's two big hospitals here, hospital systems, or one of them, and we'll call Bumpsy Dallas. What also on the campus is Texas A&M Health Science Center. It's one of the branches. There's also like a dental school, and so we interact with a lot of students. And then we also have Baylor Scott and White Rehabilitation Institute, which is the rehab hospital that we're at. So many buildings, one big kind of conglomeration. So like I said, 9 residents, and then here's that Baylor All Saints down in Fort Worth, which is like a 40-minute drive, is where the prelim year can be guaranteed. We do have a fellowship, and that ACGME accredited fellowship in traumatic brain injury. And then we have 27 board certified faculty in different specialties. And all of them really are very, very, we say open door policy uses. I'm on a texting basis. If I need anything, I'll just text them, whatever time of the day. And then we also rotate with like ortho, radiology, geriatrics. We kind of rotate all over, get a kind of multidisciplinary approach to our learning. That picture is us playing pickleball for one of our resident wellness events. Next one, next slide. Continuing, so education friendly. I guess to talk about that, we're really we get I think 30 days for the entire 3 years that you're here for conferences. And there's some programs that you have to like be presenting. Our program you can be presenting or you don't have to be. And almost every rotation you can take off and go to a conference if you're really interested in that, for example, in whatever specialty you are in, whatever like SCI or TBI. We also have selective rotations, so PGY3, PGY4. What that is you can just make up your own rotation for the Baylor doctors in the Baylor Scott and White Health System. And I think I'll make another point about that in a later slide. Yeah, so we have a lot of private practice doctors who went to this residency, who we rotate with. We have a lot of academic physicians always, and then we rotate with like every fellow, every like SCI, TBI, pain kind of docs, and house staff, GME, all that great support. And that I think this picture is us at a dinner or a lunch that I wasn't in. Darn. Next slide. So here is, our typical rotation. So per ACGME, most of the rotations are going to be similar for the programs that you see today. ACGME requires 12 months of inpatient rehab, and then they require some outpatient EMG. You got to meet these really numbers. So that's what kind of a lot of them will look the same. It just might be in different like PGY2, PGY3, PGY4. Our inpatient is mostly in PGY2. I think it's like 9 or months of inpatient, and then you have like 1 or 2 months in PGY3 and 1 or 2 months in PGY4. And then you can see those selectives, right? So I matched actually recently into an interventional spine fellowship, and I use both of those selectives to rotate with a interventionalist. We do have some, but I wanted to rotate with more that were not associated with Baylor. And I, hit up Taylor Ann, and she like got to work on doing all the paperwork and stuff. And like before I even knew it, we were approved. You just have to have a reason why, and it was no problem. So it was good. And then another comment on this is we have EMG here, those 2 months in the PGY2, and then 1 in PGY3. You're required to get 200 EMG nerve conduction studies, and like I don't think anyone has ever had a problem getting that number. We always just like it's someone has a problem only if they're not logging like the entire year. You can probably get all of it in PGY2 and PGY3 without a doubt. I think I'm almost done, and I'm in the beginning of my PGY4. So next slide. So if people who don't know Texas, this is DFW. Now the circle in the middle obviously is the one right over. Yeah, that is where our primary location is. That's where the conglomeration of all the hospitals are, and like Baylor, Bumpsy, and Baylor Rehab Institute. we're there like, I don't know, like 85% of the time. And then I would say we're also in like, 5-10%, and then Waxahachie 5-10%. And then all those places up north, we are there, but honestly, I haven't been to McKinney yet. I've been to Frisco, but it's not. It seems like a lot, but a lot of the time we are in Dallas. But the Fort Worth rotation, uh, it is a drive. I'm not gonna lie, especially in rush hour, it can go from 45 minutes to an hour. But we have talked amongst our residents, and those rotations out there are so valuable, and those attendings are so awesome that we did make that drive happily. And the best thing about that actually is that 45-minute hour drive, you're actually reimbursed for the gas and the wear on your car, as long as you submit a report. So that's good. And same thing for Waxahachie and all these other locations. Next slide. So again, I'll talk about the selective rotation. 1 month PGY3, 1 month PGY4. Dr. Hamilton is pretty good at taking resident feedback on like, hey, what can we improve? She meets those twice a year. And we said, hey, like, can you move up these selectives, because pain medicine, NAS, sports and spine, interventional spine fellowship is pretty early in the year. So they took that feedback, and now we've actually moved them up a lot more in our PGY3 and PGY4 year to help those people who are interested in those fellowships. Again, I kind of touched base on this already here. Sports, cancer, we have sports docs, cancer docs, pain, obviously, in our core rotation, palliative, wound care, research. You can kind of do whatever you want in terms of your selective rotations, as long as it's improved. So for example, I did like, 2 days with one doctor who's an interventionalist, 2 days with one doc who did EMGs, and 1 day for research. I think next slide, I think that's it. So again, here for research, to touch on that, it is required for the ACGME to do some type of research. So no matter what institution you are at, you'll need to do some type of academia. We have actually a really, really supportive and great research department. They're doing always doing projects, and they actually give us lectures twice a month, and we have access to them. Again, here a couple of residents doing poster presentations. They'll help you with IRBs. They'll do your data crunching for you. They'll do your lit review for you. And we have a lot of in our rotations. We have a lot of rotations where the afternoon you're just dedicated research, or 1 day it's like dedicated research. So you have more than ample time to do whatever your interests are. I'm doing something that I want to that would help me with my fellowship. So you don't have to do like STI or stroke, or if you're not interested, you can do TBI if that's what interests you. And next slide. Oh wait, hold on 1 second. Is this talk about, yeah? So here it talks about, so we are actually TBI and STI model systems. And those people who don't know what that is, there's only select few hospitals in the nation that have that kind of grant and data aggregation. And we are one of those centers for both TBI and SCI. I think Houston is the only other one in Texas. Yeah, so next slide, please. So as a medical student, you start realizing, as a resident, you start understanding what things were important when you were looking at programs. The important thing on this slide is the thing in yellow. So from every Tuesday, it can 7 a.m. to 12 p.m. Sometimes it's 8 to 12. But most important thing is it's protected, right? So I remember one time I got paged when I was a PGY2. I was like, oh, I don't know what to do with this. And then our program director took the pager, and she's like, don't worry about it, I'll handle it. So here, education is really important. You're not responsible for rounding in the morning. You don't have to do those notes. Any pager calls, you're not responsible for until after 12, until after our didactics. Monthly grand rounds and journal club. You do a couple of, I think 2 journal clubs a year, very chill, laid back. And then same thing with the 17-month rotating topics. That's kind of for board review. You'll hit every topic that's going to be tested on the PM&R boards at least twice. Guest lectures and field trips. Here we got that. We have a patient here with, I think it was AKAs, and he was a motivational speaker for us. And we went to Fort Worth clinic where they did kind of our lectures. We have a lot of kind of flexibility in what we do for didactics, since the chiefs kind of make them, and Dr. Hamilton, our program director, is very supportive on what we do, as long as we're learning, and as long as you know it's for the boards. Also, the ultrasound course, a lot of the recent years, a lot of medical students, and kind of the census and PM&R is like, let's get more ultrasound. And Dr. Hamilton has realized that. So we actually hire a guy. He's like an ultrasound guru who comes from Houston, and we spend an entire day with him, not just didactics. It's like an 8 to 5 day with him twice a year, right? Just scanning the entire body, all the muscles. Like one day is upper extremity, and like the next semester it's like lower extremity. And then on top of that, in didactics, we do ultrasound resident run. And then also in the top left picture is our ultrasound guru, Dr. Mukherjee. We have anatomy lab, so we're always using 2 ultrasounds, one time a month on cadavers, specimens like upper extremity, lower extremity. So we have, like, if you want to do ultrasound, you have more than enough opportunity. If you don't want to do ultrasound, that's fine. You just gotta stick to the didactics ones. And that right picture is me putting in the acupuncture needle in our wonderful volunteer Taylor. So yeah, that was the guest lecture. Next slide, please. So again, this is another one of those things like you should know as a medical student, that you learn is really important as a resident. So what is the call schedule? So our call is home call, and I am actually on call right now. So we take home call, and how that works is so you do your regular duties, right? Whether that's clinic or inpatient, or your selective rotation, whatever that may be. You do, and if you see the PGY 2, 3, and 4, you do 9 weeks the first year, 6, and then kind of 2-ish weeks the third year. So you are responsible for a pager from Friday 5 p.m. to the following Friday 7 a.m. And you do your regular whatever rotation you're on. Now that sounds like a lot, but the whole time I've been on, my audio's been on, this pager has not went off. I hope I didn't jinx myself, but it's actually very not as difficult as it sounds, right? At first I was scared, but now I can go work out. If I can do whatever. You just kind of need to stay within 30 minutes of the hospital, and be able to put in orders. The nursing and the nurse supervisors are very good, and there's no physician on campus usually after like 5-6 p.m. So those patients will come in. A lot of them are very kind of minor, and we're a standalone hospital. But if there's something that someone's in having an emergency RVR, or needs to be intubated or something, we call EMS, and the emergency room is like right across the street, so there's no issue there.
5 minutes remaining.
Continuity clinic, just self-explanatory. We have our own patients that we own. I had that this morning. No issues there, and I talked at length about didactics. Oh yeah, we also practice oral boards, so that's really good. Every when you guys rank your list, make sure if there's any practice for oral boards, because I think you guys don't have to do it, but when I was back in middle school, we had to do the oral presentations, and we put ourselves in the hot seat, and it's really good feedback on practicing like a real encounter that we will have to do to get boarded. Next slide, please. This is just all this is also really good. 15 days vacation. Usually every place does that. 3 sick days, 30 conference days. Remember those conference times, you don't have to be here presenting. Every year we get stipend, $250 for books, question banks, and then you also get the stipend for those 30 conference days, $5,500. And I have flown around the places, stayed in good hotels, and then I think we have one of the really, really great cafeteria. Again, super high yield thing to know about places, right? You're gonna be eating there for 3 years. We have really good cafeteria. We have like a Chick-fil-A, Which. We have access to the physician lounge, even though it's not free, but we do get discounts on food and $120 a month. I think it's I think it's like enough for the month. Get those memberships. Parking is like I can take like 10 jumps from my car and get into the hospital from where I park. We have amazing parking. And then we have a new resident gym that Bumsy is just building. And then we did 2 resident wellness. We did paintball, and yes, Dr. Hamilton did play with us, and we did get to shoot her. And so we'll go next slide. I'll try to get some time for questions. Oh, perfect. All right. Any questions? It's good if you have questions. Ask them now. The chat. All right. I mean, this here is skyline of Dallas. The tall building right there is the main Dallas, the Baylor one. And then our rehab hospital is actually not shown in here, but fine.
Question in the chat.
All right.
Can you expound more on the sports meds rotation? What teams do you collaborate with?
So we don't, if you're asking about teams as in like the sports teams, we don't collaborate with like the, like the Mavericks or Cowboys or whatever. But we do rotate with like with physicians, sports med trained docs who cover high schools. There was like this, like not WNBA, but like this competitive tournament, and I did physicals for some WNBA players, which was really cool. And if you like the opportunity, you can seek out for that. One of our last year, one of our residents matched into a sports medicine fellowship. But it's really just rotating with sports trained PM&R docs is the rotation, not really specifically with like the baseball team here or the Cowboys or the Mavericks, things like that. And another question, I appreciate you have it. Thank you for having. Do you accept US IMGs? And do you have board score cutoffs? Taylor, we accept IMGs, correct? Yeah, we do. We don't have a board score cutoff. One of the, I think we do, but like it's not. I don't know how much I can talk about it, but whatever. It's not like, and you'll get the census later. Like scores is not the only thing that's going to get you in. It's going to get you to the door. I don't know the acceptance rate for IMG students.
No, I don't know that either. I'm pretty new. We haven't had any since I've started, but I've only been through one recruitment season. I know we've had some in past years, but we're a small class, so it's only 3 per year that we recruit.
Mm-hmm. Yeah, we accept IMGs, but I think the best thing is like, rotating here, connecting with, seeing you're a good fit personally. You guys choose us as much as we choose you. Didactics are available virtually. I'm not sure if we're allowing students or applicants to attend though, who are not who don't rotate with us. I have to ask Hamilton, I guess, right, Taylor?
Yes,
usually
you
we
can email me. I'll drop my email in the chat for the link.
Thank you to Baylor for their awesome presentation this evening. You are totally welcome to stay on and answer any of the remaining questions in the chat. And thank you for your presentation.
Thank you.